and listen. All participants have joined in listen-only mode and are muted. If you have any questions, if you would kindly submit them in the Q&A feature, please. My name is Rachel Hammond. I chair the iPHD Governing Board as the Commissioner of Health's designee. I am also the Chief Ethics and Data Privacy Officer at the department. As the department's data privacy officer, my mission is twofold. First, to protect the privacy of the people whose information the department receives. And second, to facilitate the legal and ethical use and sharing of that data for public health purposes. So as chair of the iPHD Governing Board, I am in very familiar territory as the iPHD project also fulfills this mission. Through robust security and privacy data governance, policies, and processes, the iPHD project securely links state agency data sets and makes that data available in a de-identified or limited data set for use in research projects approved by the iPHD Governing Board. Approved research projects will provide critical information to improve the health, safety, security, and well-being of New Jersey residents, as well as improve the efficiency of state government. As members of the iPHD project's research consortium, you play a critical role in facilitating actionable population health research to help improve health outcomes for New Jersey residents, as well as promote New Jersey's research institutions as leaders in social science research. I am delighted to officially announce today the launch of the iPHD project. We have been excitedly waiting for quite a time to be able to make this announcement and celebrate the launch of the project. Next, I'd like to just briefly review the agenda for today, and then I will introduce our keynote speaker. So today, we will provide you with information about the iPHD project itself, as well as the application process. I will provide you with a brief overview of the iPHD project statutory authority as found in the iPHD Act, as well as governance and oversight of the iPHD project. Joel Cantor, Distinguished Professor and Director of Rutgers Center for State Health Policy, and also an ex officio member of the iPHD Governing Board, will provide information about the iPHD project research priorities and available data sets. Margaret Kohler, Executive Director of Rutgers Center for State Health Policy, will provide information today about the application process, available funding, and data-only applications. I do want to note that you are hearing today from only a very small handful of the very large village that was involved in operationalizing the iPHD project. There are many, many others who played a key role in bringing us to this point in this very important project that will improve population health in New Jersey. So again, I thank you, the members of the research consortium. I want to recognize and thank our colleagues from the Rutgers Center for State Health Policy, colleagues from other state agencies who have been consistently participating in and supporting the iPHD project, members of the governing board, and our colleagues at the Department of Health, the data stewards for the data sets that have been transmitted into the project, our current health commissioner, and previous health commissioners. So before we dive into the agenda, I am honored to introduce Commissioner Persicelli, who will deliver opening remarks. Judith Persicelli began serving as the Commissioner of Health in August 2019. She has been alongside Governor Murphy, leading the state's response to the COVID-19 pandemic. Along with the response to this truly once in a century public health emergency, under her leadership, the Department of Health works to protect and improve the health of New Jersey residents. The department's priorities include reducing health disparities, improving maternal health, addressing the overdose epidemic, and increasing access to healthcare. Prior to leading the department, Ms. Persicelli served as the acting chief executive officer of University Hospital in Newark. Ms. Persicelli was president emerita of CHE Trinity Health, the health ministry formed in May 2013 by the consolidation of Catholic Health East and Trinity Health of Livonia, Michigan. She previously served as interim president and CEO of CHE Trinity Health. And prior to this appointment, Ms. Persicelli was president and CEO of Catholic Health East. Ms. Persicelli joined Catholic Health East in 2003 as the executive vice president of the Mid-Atlantic Division. She was promoted to executive vice president of acute care for the system in 2008, and then to executive vice president and chief operating officer in December 2009 before assuming the role of CEO. Prior to joining CHE's system office, she served for 8 years as the CEO at St. Francis Medical Center in Trenton. Ms. Persicelli received her nursing diploma from the St. Francis Hospital School of Nursing, a Bachelor of Science in Nursing summa cum laude from Rutgers University, and a Master of Arts in Administration summa cum laude from Rider University. So Commissioner, on behalf of the iPHD project and the governing board, we thank you for your support and leadership. And I'm delighted to welcome you and turn it over to you to deliver opening remarks.
Thank you so much, Rachel. It is exciting to join you today to mark the launch of the Integrated Population Health Data Project, iPHD. First, I'd like to thank Rutgers Center for State Health Policy and the iPHD governing board, led by our own state health departments, Rachel Hammond, for their leadership in moving this valuable project forward. The iPHD project is aimed at improving the health, safety, and security of New Jersey's residents and at improving efficiencies. This launch will now enable researchers from New Jersey's academic institutions and from medical schools affiliated with New Jersey's universities to begin submitting applications to access data available through the project to support approved research projects. The 4 identified research priorities, the opioid epidemic, maternal and infant health, social determinants of health, and COVID-19 and other public health emergencies, will examine the most immediate healthcare and health equity issues within our state. The opioid epidemic, maternal and infant health outcomes, and the social determinants of health have all been exacerbated by the pandemic. And understanding our journey through COVID-19 will help inform and further prepare us for future public health emergencies. Data-driven decision-making has been key to the state health department, and particularly as it applies to the COVID-19 pandemic. Since the pandemic began, all the department's policies and strategies have been developed with the goal of achieving equitable community protection. And through it all, we have been guided by data. For example, we know from the daily collection of hospitalization data from every acute care hospital in the state how COVID-19 is presenting in the form of severe disease. We know from our case surveillance data where hotspots are emerging that require a stepped up focus. We have used predictive modeling from the very early stages of the pandemic to assess the potential impact of COVID on hospitalizations, intensive care, and ventilator use, so that the state could provide guidance to hospitals as they planned for impending surges. In the spring of 2020, the department was using Penn Medicine's COVID-19 hospital impact model for epidemics, also known as the CHIME model, which was designed for hospitals to estimate how many patients would need hospitalization, intensive care, and ventilators. In parallel, we developed our own predictive model. We used it along with CHIME and the University of Washington's Institute for Health Metrics and Evaluation, or iHME model, to help inform hospitals throughout the pandemic. Comparing different models allowed us to test the validity of our own model. The result of this rigor was the accuracy of predictions our model has shown over time. Predictive modeling underscored the critical importance of preparing our hospital systems for expected surges, not only bed capacity, but workforce capacity as well. It also underscored the importance of increasing vaccination rates. As part of our efforts to ensure equity, we created a vulnerable populations plan focused on vaccination of high-risk individuals in long-term care, other congregate settings, seasonal farm workers, individuals experiencing homelessness, individuals with substance use disorders, individuals who are homebound, our tribal nations, people with disabilities, individuals over 65, and elderly residents in high-rise apartment complexes. We developed an equitable vaccine access methodology using the Social Vulnerability Index, including percent poverty, percent of communities of color, the COVID death rate per 100,000, and the percent without car ownership to focus our efforts and increase access and uptake of the vaccine. We recognize that the longstanding inequities that have contributed to health disparities disproportionately affecting racial and ethnic groups have also put underserved communities at increased risk for COVID-19. So last summer, we developed a county ambassador program in 11 counties that needed support to reach a minimum of 70% adult vaccination coverage. Key Department of Health staff were deployed into these counties to focus on COVID-19 vaccination efforts. They used a data-driven and collaborative approach with local leaders and community organizations to drive boots on the ground actions to increase vaccinations. We've used data to build awareness and education through discussions with over 1,000 interest groups, professional and civic associations, religious leaders, and elected officials. The result of these efforts has been one of the most successful vaccination programs in the nation. Research that uses appropriate and informed analysis of data can help provide insights on programs and policies to improve accessibility and availability of healthcare across issues throughout our state. Combining and collecting data from multiple sources has helped and continues to help inform decisions and all of our policy recommendations. Within the department, the centralized data and analytics hub also has been instrumental in New Jersey's COVID-19 vaccination efforts. It has provided data-driven insights to lead and innovate public health through faster and improved data-driven decision-making and democratizing access to public health data. Data collection and analysis that had been operating in separate silos highlighted the need for integrated data that can be cross-referenced to illuminate trends and needs. Tracking vaccinations among vulnerable and high-risk populations, especially by county, help focus delivery channels and improve health equity. Looking ahead, we are eager to see what researchers will step forward this summer through iPHD to apply New Jersey's data to enrich our understanding and responses in COVID-19 and beyond. The work of the iPHD project to focus on priority issues in population health will help identify insights and perspectives for public health initiatives that will ultimately help improve outcomes. So thank you again for undertaking this important work, and we look forward to all of your efforts. Thank you.
Thank you, Commissioner. And thank you again for your support and leadership.
You're welcome.
Okay, so we will now dive into the agenda. I'm going to start by talking about the statute, the iPHD Act. So the iPHD project was created in law in January of 2016. So what is the purpose and the goal of the iPHD project? As stated by the Act, the goal of the project is to improve the health, safety, security, and well-being of New Jersey residents, as well as the efficiency of state government. So how does the iPHD project meet this purpose and achieve this goal? By securely linking administrative agency data sets to support approved research projects. Some of the key provisions of the statute, getting into how is the iPHD project to be operationalized. Rutgers Center for State Health Policy is specifically charged by name in the iPHD project to operationalize a project capable of securely receiving, maintaining, and transmitting data consistent with HIPAA privacy and security standards. The iPHD project shall seek to transmit de-identified data wherever possible for approved research projects, but may transmit individually identifiable information such as a limited data set if permitted by the laws that apply to each data set, and also in a form that is secured to prevent further disclosure of that individually identifiable information. So what does the Act tell us about how is the Center for State Health Policy to operationalize the project? So relative to ensuring reporting and transparency of the project, the iPHD project is required to publish an annual report following receipt of data by the project, describing the activities of the iPHD project, including approved research projects. Relative to funding, the iPHD project is authorized to apply for and receive funding, as well as charge fees of individuals or entities seeking to access data from the project. Relative to ensuring data security, the iPHD project has undergone review by the New Jersey Cybersecurity Communications Integration Cell, which is in the Office of Homeland Security. Consistent with HIPAA and iPHD policy as approved by the iPHD Governing Board, the project shall securely transmit de-identified or limited data sets as those terms are defined by HIPAA for approved research projects. The Act also authorizes state departments and agencies to transmit their data to the iPHD project where permitted by law and where consistent with the goals of the iPHD project and following the execution of a data use agreement with the project. The Office of Attorney General is charged under the iPHD Act with assisting in determinations of whether any transmission of state agency data to the project is authorized by law. So with every data set in state government having a different enabling statute, the Office of Attorney General also plays a critical role in ensuring data sets can be transmitted to the project. Relative to the research consortium, the iPHD Act specifically requires the Center for State Health Policy to organize a consortium of researchers from New Jersey academic institutions and from medical schools affiliated with New Jersey universities that will facilitate actionable population health research to help improve health outcomes for New Jersey residents, as well as promote New Jersey's research institutions as leaders in social science research. So you, the Research Consortium, are also a critical piece of the puzzle in operationalizing the iPHD project. So next we can move into discussion of what the iPHD Act requires relative to governance and oversight. So oversight of the iPHD project is vested within the iPHD Governing Board. It is a 10-member governing board, which is in but not of the Department of Health. As you can see, it's a blend of public and ex officio appointments and expertise. The governing board members are subject to statutory conflict of interest requirements in the act itself, as well as the New Jersey Conflict of Interest law. All governing board meetings are open to the public under the Open Public Meetings Act. And here I'd just like to take a moment to thank the members of the iPHD governing board, past and present, for their service to and support of the iPHD project. Specifically, I would like to recognize former iPHD governing board member Ranjana Madhusudan. She was the state treasurer's designee who sadly passed away in April of 2020. Ranjana was the state's chief economist, and she was a dedicated member of the iPHD governing board. So what does the iPHD Act require relative to how does the governing board perform its responsibilities for governance and oversight? The governing board is required to identify administrative agency publicly supported programs data, which is appropriate for inclusion in the iPHD project. The governing board is required to consider whether the agency holding the data has legal authority to collect the data and to identify whether the data set includes individually identifiable information. The governing board is required to consider whether inclusion of a particular data set will further the purposes of the iPHD Act, and to also inquire relative to have reasonable efforts been made to ensure the iPHD project will receive only the appropriate data to accomplish the purpose of the iPHD Act. It's a bit of the minimum necessary principle. The governing board is also required to ensure that appropriate data use agreements are in place prior to the iPHD project's receipt or transmission of data. The governing board is also charged with establishing and adopting policies and procedures for the efficient and transparent operation of the project, privacy and security policies, data access policies, including a requirement for IRB review of research projects requesting to access data from the project, data retention policies, policies that require the research to consult with subject matter experts for the specific requested data sets, as well as establishing policies to engage researchers and academic institutions across New Jersey, setting research priorities that promote the use of the iPHD to accelerate population health research in New Jersey. So with that said, a little bit of framework about the iPHD project. I would now like to turn over to my colleague, Distinguished Professor, Director of Rutgers Center for State Health Policy and iPHD Governing Board ex officio member, Dr. Joel Cantor, who now talk to us a little bit about the iPHD project's research priorities and available data sets. Joel?
Great. Thanks very much, Rachel, and welcome everybody. This slide describes in a bit more detail the research priorities of the iPHD. The commissioner mentioned these at the outset. As you can see there, are some of the sort of most pressing population health issues of the day. The governing board purposely framed these issues rather broadly so as not to presume what the research questions are, but rather to direct research applicants for data to think about the highest impact research that they can do in each of these priority areas. Next, please. So this is a list of the 5 data sets that the governing board has approved to be transmitted to researchers through the iPHD. And as you can see on the slide, most of them we have specific dates of the data that will be included. The data sets include the VIP, the New Jersey birth record data, mortality data, the all payer hospital billing record data from every hospital in acute care hospital in New Jersey. The COVID-19 data from the CDRSS, the Communicable Disease Reporting and Surveillance System, will also be available in the linked data set. Fifth data set, New Jersey Emergency Medical Services data, very, very rich data, very complex data from the EMS system, the pre-hospital, often called pre-hospital services offered through our EMS services. We're diligently working on preparing that data set, and we anticipate that it will be available not for this round of applications, but for the next one down the road. Next, please. So both the commissioner and Rachel mentioned the research consortium. It is a requirement that the center convene the consortium regularly. It's part of the iPHD law. We're using today's research consortium meeting to try to reach a broad audience, especially of New Jersey research institutions and researchers, to orient you to the program and announce the availability of data and pilot awards. Over time, we will be using the research consortium to help promote collaboration among researchers across the state, advance research capacity and expertise in the state, and as an avenue for researchers to provide input on future research priorities and data sets. So stay tuned. We will be in touch and invite folks to participate in further discussions about and really have the research community help guide the iPHD project. Now I'm going to turn over the virtual microphone here to my colleague, Margaret Kohler, who is Executive Director of the Center, and she'll dig a little deeper into the application process.
Thanks very much, Joel. And good afternoon, everybody. Thank you for joining us. So you've heard of the background and sort of the genesis, the goals of the iPHD, but now getting down to brass tacks, let's talk a little bit about the application process. And I think for most of you, that's really obviously the of interest in knowing how we're going to operationalize this. So first off, this is our first application. This is the first cycle. We anticipate that we'll be doing implementing 2 cycles per year. So starting now with applications and proposals due in July, and I'll talk a bit about the timeline, but we're planning on the first cycle being in July and then a second cycle in January of 2023. Any qualified researcher whose proposal aligns with the approved purpose and priorities of the iPHD are encouraged to submit applications. So who does that include? That's New Jersey research institutions will be eligible to apply for pilot funding, and we're anticipating up to $40,000 per award and budgeted for approximately 4 pilots to be funded in this first cycle. In addition to providing the seed money or the pilot funding to the 4 applications, those pilot will also have their data access fees waived. And I'll talk about the fee schedule and the access fees that are associated with each of the approved projects. Again, the data access fees apply to approved applications, with the exception of those that are receiving pilot funding, and those applications then have the additional benefit of having their fees waived. Students are eligible for, with faculty supervision, to apply for data or funding from the iPHD. So we do encourage the training and development of the next generation of health services researchers. So yes, students are eligible to comply to apply. All of the applicants, you must comply with applicable law and iPHD policies and procedures. Over the last 3 or 4 years, keeping in mind, as Rachel said, The legislation was passed in 2016, so we've spent a lot of time trying to implement and put together the framework and the architecture that supports the implementation of the iPHD, and that includes extensive policies and procedures and security checks. So we expect that the applicants, the research institutions, have to comply with privacy and security guidelines, have to have an IRB approval from the applicant's institution. I should note that the IRB approval does not have to be in place prior to submission, but if the application is approved by the governing board, goes through the research advisory committee process approved by the governing board, the IRB has to be in place prior to the transfer of data pursuant to a data use agreement. And we'll talk about that. And the researchers, the applications have to be consistent with the minimum necessary data provided. So the HIPAA being HIPAA consistent, and we will only be releasing, the Center for State Health Policy will be releasing the minimum necessary data to address the research question. We do seek a diverse pool of applicants, including researchers from underrepresented groups. And I would point you to the iPHD website, which is iphd.rutgers.edu. We have a pretty substantial, couple of pretty substantial and well-populated pages about the application process. Again, we think it's informative, but if you have any questions throughout the process, certainly contact any one of us, and we'll certainly provide assistance in terms of submitting the application. I think what's really important here, and we want to emphasize this, you'll see on the URL, this is iphd.rutgers.edu. And while there are a number of our Rutgers colleagues on this call, and we certainly appreciate this, this is much more than just a Rutgers endeavor. This is a service that's provided to the state, to the research community, and the goal is to inform population health in New Jersey. So we want to be very broad in terms of our outreach and engagement with researchers so that we can have the maximum impact in terms of the work that gets seeded through the iPHD. So Oliver, can you go to the next slide, please? So here are the proposal requirements. It's pretty accelerated given the timing of today's June 1st. So if we're looking at a letter of intent by June 15th, in the next 2 weeks from today, and the full application by July 15th, 6 weeks from now. We think this is not at a level of applying for NIH funding. We have really tried very hard to make this a streamlined process, to not have it be overly burdensome in terms of the documents that we're requiring at the point of submission. And obviously with the somewhat limited time frame that we have here, understanding that this is, there well may be questions, and we're certainly going to have to work through any issues, but we think this is manageable. And the reason why we have these dates of being a little bit of aggressive is, frankly, we want to get going. This has been a long time coming. There are pressing needs. There's a lot of research that's being done now, and we feel that we can make that match, and really to be able to have that impact that the commissioner talked about, and the need for data-driven policymaking. We've certainly seen the need for that certainly over the last 2 years. So the letter of intent is merely a page, maximum of a page. It's mandatory but not binding, meaning that you can submit a letter of intent and not submit a full proposal in July. It will not be considered or scored and reviewed in the application review process. Again, more instructions on the website, and you can submit the letter of intent to iPHD at ifh.rutgers.edu. And for us, really, it's somewhat of a logistical request, because with the letters of intent, as you know, and Joel is going to talk about this in a couple of minutes, about what the research advisory committee is and our research process, that we have 3 researchers who are going to be reviewing all proposals. So this is trying to do some resource planning so that we can gauge how many applications we think we'll get in July. So fast forward, we have the letter of intent, the LOI in June, and then July 15th, we have the full application. And that includes a cover page, an abstract of 250 words or less, proposal narrative of a maximum of 5 pages, single spaced, a data request form where you can request the data sets and the linkage years and data elements, and we do have the data dictionaries on our website for all but the CDRSS data. So you can certainly use that as a reference tool. As I mentioned, IRB approval not required at the time of application, but will be required before the release of the data. A budget and a budget justification only if the applicant is applying for pilot funding. I do think that if people are looking just to request data, then obviously you don't need to complete the application form. The PDF everything and send it back, with the exception of the spreadsheet, the Excel spreadsheet with the budget. PDF it back to us at the email address iphd.rutgers.edu. There's the instructions and the forms. And specifically, you'll see on the next couple of slides, I think we have some screenshots of what to look for on the website. A couple of things that to just say in general about the application process. As I mentioned, we're aiming for 4 pilots funded at $40,000 each, and those are obviously it's going to be competitive in terms of the review. So some applicants that are applying for funding may not get it, but may well receive the data, but just not receive the funding. Our strategy and our commitment in terms of the application process, obviously with regard to the rigor of the review process, and again, Joel will talk a little bit more about this in terms of making sure that, again, that it's a rigorous review process and that there are recusals in place to avoid conflicts of interest. We really want to maximize the impact of this project. So we are going to do our best to get to yes in terms of reviewing the applications for data. Obviously, it needs to be quality, and they need to be quality applications. Again, all of the requirements that we've discussed heretofore, but we really see this as a service that is informing policy in New Jersey. So if there are questions along the way, if you do need some guidance in terms of the preparation of the application, we are happy to answer questions between now and July 15th. If something is not attached or there's a document missing in the application process, we're going to take every reasonable effort to communicate with the applicant to complete the package. Again, part of this is going to be dependent on the volume of applications that we get, but we really have discussed that we want this to be to really have a strong customer service function, if you will. So to the best extent possible, and frankly, certainly on the first wave of applications, we want to make ourselves available to put people in the best position that they can be to submit a quality application. And then as we go through this first cycle, if we can answer questions and support you, we're going to certainly do that, because the idea is not to be weeding out applications so that we, can limit the number of data sets that we send out. There are resource considerations, but I can share with you our commitment to being as helpful as we can in this process. So Oliver, can you please hit the next slide? Again, just some highlights. This is our website that we've built over the last 2 years, again, with support and funding from the Department of Health, which has been very generous in supporting this effort through implementation, iphd.rutgers.edu. It is an electronic submission process. So if you hit the next slide, Oliver, please. And again, we have a page that is just for the submission process. You can see we have applying for data access only. There are instructions and forms and different documents to inform the as well if you were applying for funding through the pilot function. Next slide, please, Oliver. Again, just more screenshots here. We think this is pretty intuitive. Downloading application documents, differentiating between materials for data access with pilot funding, and then applications and materials for data access only. But again, as you work your way through, please, if something is not intuitive or not clear, I think many of you know this, the staff and the faculty at the center. Please don't struggle with any questions. Please reach out to us, and we'll be happy to have a conversation with you or help in any way we can. Next slide, please, Oliver. There are two other features on the website that I want to call out: frequently asked questions. So our FAQs, again, we've curated these questions over the last 3 years, frankly, as we've gone through all of the implementation steps and some of the growing pains in terms of putting all of these pieces together. We will be mindful of consistently updating these FAQs, and in fact, after we put these slides down in a couple of minutes, and we have a discussion period going through the FAQ or the Q&A session. Any of the questions that come up today that are relevant, we'll update these in the FAQs. And as well, we have a button so that people can sign up for information and stay on the mailing list for the iPHD. There is a communications function to this effort. We do need to get the word out. We do want to grow the iPHD. This is iPHD 1.0 that's launching right now, and we're already thinking about what the next iterations are. So we do want to be, growing the audience, growing this research community, the consortium, so we can start thinking about building to the next version of the iPHD. So you will be hearing from us, so stay in touch. I think the next slide is, this is just the last slide to give you some context and some idea. And I should say, and Oliver put it in the chat, because there was a question about the slides will be made available, as will the recording of this presentation today of the webinar. So here's the fee schedule, and this probably took us a good year to put the fee schedule together. It was reviewed with the iPHD governing board. It was reviewed and approved by Rutgers Cost Accounting. This is I think what's important here to differentiate here is there is no application fee just for submitting an application. There is an established project setup fee per project that is approved. For non-New Jersey institutions, it's $5,000, and for New Jersey institutions, it's $3,600. And the difference, obviously, is the support from the New Jersey Department of Health to cover some of the costs, mitigate some of the costs that are associated with providing the linked data set back to the researchers. There is a little bit of subsidy then that we're using our funding from the Department of Health to offset some of those costs for New Jersey applications. And again, only New Jersey research institutions are eligible to receive the pilot funding. And to sweeten the pot a little bit, there is, as I say here, a little bit of an offset in terms of the fee schedule. Then you can see we priced out the per data set what the cost will be for data preparation, the birth data and mortality data, the hospital discharge, and the COVID-19 surveillance data. You'll see that sort of incrementally the price goes up, certainly with the COVID-19 surveillance data, the CDRSS. And I should say that the CDRSS data includes many other communicable diseases. Through the data use agreement when we have with the Department of Health, we will only have access to the COVID-19 surveillance data as part of that data set. And again, the cost of $16,000 for non-New Jersey institutions and $14,000 for New Jersey institutions. You'll see it's grayed out here, but as Joel mentioned, we anticipate bringing the EMS data on board probably early part of 2023. So potentially in the second wave of application, we'll have the NEMSIS, the EMS data, and that's really going to be a rich data set when you think about some of the constellation of linkages that you can imagine between having the mortality data, the COVID data, the EMS data. I think this is hopefully whetting the appetite for researchers to see the possibilities of bringing big data sets together. So the upfront costs are in the setup, additional data years, kind of nominal costs to add per year per data set. But of course, depending on budgets, that can add up. The additional data linkage beyond one, again, somewhat of a nominal cost. So it's really those upfront linkages where the initial expense is. Technical assistance beyond 1 hour, and it is $260, and that's consistent across for both New Jersey institutions and non-New Jersey institutions. So I think that is the high-level overview of the fee schedule. Next slide, Oliver. I think now I'll hand it back to Joel, and he'll talk a little bit about the application process, the review process, and some of the criteria for approving projects. So Joel, you want to tell us a little bit more about the process, please?
Yes, certainly. Thanks very much. I know we're throwing a lot of information at you. As we've mentioned a couple of times, we will be sending out the slides and the recording to everyone who registered for the webinar. Plus, this is all on the website. And we've tried our hardest to make it accessible and easy to find. Of course, always send us questions if you have them, and folks have been putting questions in the chat. I was trying to keep up with them, but they're coming in fast and furious now, so I can't. So I'll turn to the last few slides here, and then we will turn to answering the questions. Just in terms of process, the applications will come in via the website. We have staff at the center who are prepared to address any questions you may have as you're preparing the application, so don't hesitate to reach out. We will be doing a compliance check, if you will, make sure everything is there. And then the center will be sending applications out to reviewers, and we've lined up a wonderful, highly expert research advisory committee. Just a little footnote, we adhere to the conflict of interest rules and guidance and ethics guidance, and we'll talk about that a bit. Applicants that are closely affiliated with the center are in the same units that we are. There's an outside member who will be doing the reviewer assignment, just to avoid any appearance of conflict. Once the reviewers have reviewed, we'll assemble their comments, and I'll describe what they'll be reviewing in a moment. And then that goes to the governing board, and only the governing board can make decisions about approving applications for data. They'll also be making the decisions about or recommendations to the Department of Health about which ought to be funded under the pilot initiative. They'll have all the RAC, the advisory recommendations, but the decision is theirs. Once applications are approved, it comes back to us at Rutgers, where we work with university officials to process data use agreements between Rutgers and the data recipient. Excuse me. Our staff will also be preparing limited data sets for the approved applications. We apply the HIPAA minimum necessary rule here, so you'll be requesting what data you need. Once it's approved, we give you only what you need and not more. The data set, we do the linkages in-house at the center. Somebody posted a question in the Q&A about who's doing the linkage. So we would send the data sets out to you with a common ID, and so you won't have to do the matching. We're taking care of that. Our staff are available to provide assistance in understanding the data. As Margaret mentioned, the fees include 1 hour of help, which we think will be adequate for most folks, but for a small additional fee, our staff can be available to assist further. it is also a task assigned to us at the center that we assure compliance with all of the requirements, including reporting requirements, presence of the IRB approval and so forth. So those who are approved for data will be hearing a lot from us about meeting those requirements. Next, please. So the application, a little bit more about the application review process. So following guidance of the governing board, we have identified 34 experts to serve as RAC members. And they fall into these three categories, and some people are more than one of these things, but we wanted subject matter experts in the subject matter being the approved research priorities, research methodology experts, and people with expertise in the data sets to get a nice well-rounded review. Each application will be assigned to at least 3 members of the RAC, covering each of the, at least one covering each of those 3 areas of expertise. They will review using a protocol that we have developed, and then make their recommendations to the governing board. And that'll all be in writing. Then it goes to the governing board for determination. There will be a subcommittee of the governing board that reviews and makes specific recommendations about which applicants will receive pilot funding. As Margaret mentioned, that's by necessity a competitive process. So we think those applications are going to need a lot of discussion. And the board reserves the right to fund any that they deem most appropriate for funding. They'll consider the RAC input, but the decision again is theirs. All applications will be discussed in a public session of the board, and funded, and also the data only non-funded applications will be reviewed in a public meeting. That's a little bit unusual for folks who are used to foundation grants or NIH grants, but it will be a public meeting. A little bit more on that. Next, please. So as I alluded to, this whole review process in the iPHD is a public program. It's a state of New Jersey program. We are subject to all of the New Jersey conflict of interest and ethics guidelines. The governing board meetings are open public meetings under the law. Anyone may attend. The records held by public agencies overall, and specifically public records related to the iPHD, are subject to the New Jersey Open Public Records Act, known as OPRA. We understand that researchers generally consider their proposals confidential, and we believe, although it's always subject to review by the OPRA officials, that we may be able to keep applications private as under an exemption that Rutgers has under OPRA for pedagogical, scholarly, and other academic research. I think, though, it's a reasonable assumption that it may be that applications end up in the public domain at some point. We will do our best to try to keep this in this tradition of applications being private, but you know, we have to comply with the law, and we of course intend to comply with the law, and the ultimate determination will be made by the relevant officials. Next, please. Okay, so what are the RAC members going to review? And for those of you who are familiar with the NIH review process, these criteria will look highly familiar. So the first question is significance. Will the project advance the purposes of the iPHD that we've been talking about all afternoon? And will it address one or more of the approved research priorities? They'll review the qualifications of the investigators. Do they have the skills to do the job that they're proposing to do the study they're proposing to do. They'll review the approach. Is the research strategy and methodology well-reasoned and appropriate for accomplishing the aims of the project and the environment? Do they have what it takes to keep the data securely, use the data, analyze the data, and give them a reasonable probability of succeeding in the project? So one thing that's not on the list here that's implicit is innovation. So innovation is an important criterion for NIH, and it's important for us as well. However, sometimes replication of a study that's been done in another state or nationally, it might be highly relevant for New Jersey. So it may not score high on innovation per se, but we will, and the RAC members will take innovation and relevance into consideration under significance. So we're not necessarily looking to break new ground. We're just looking to break important ground here. And by important, I mean important to the state of New Jersey. Next, please. So again, just reviewing the dates that Margaret had already presented. The mandatory but non-binding letter of intent by June 15th. This will help us pick RAC members and line them up in advance to review proposals. Deadline for submission of the full proposals, July 15th. The online portal will open. Actually, beginning right after the LOIs close, the portal for submitting applications will open. Sorry, I misread that. So June 16th, you can submit applications, but you must submit them by July 15th. The earliest anticipated approval date is the beginning of November. Some may take a bit longer. And here you have the name of Manisha Agarwal, one of our colleagues at the center, and she'll be the point of contact for you if you have questions about the application process. One more slide, please, I think. Oh, that's a good one. So again, please put your questions in the Q&A box, and we will attempt to address them all. I think we can turn the slides off. And let me turn it back to Rachel for a final word while you're formulating your questions.
Thank you, Joel. So thank you as well to Commissioner Persicelli, Joel, and Margaret for your remarks and all the information that you provided today. It was a lot of juicy information. On behalf of the iPHD project and the governing board, I want to thank again all of our participants for attending today. We are extremely excited to start accepting applications. And just a few quick housekeeping things before we go into Q&A. At the end of the webinar, Zoom will open a survey. We ask that you take a moment to complete the post-event survey. As Margaret had mentioned, please keep in touch with the project. So please sign up for the iPHD mailing list so we can continue to send you important and relevant information about the project. And I think we may have popped this in the Q&A, but these slides and this recording will be made available on the iPHD website, which has been discussed, but as a reminder is iphd.rutgers.edu.
Okay, I think we can go, Rachel and Joel. Jose, I think will, there he is. So we probably have about 7 or 8 questions. The good news is about the first 6 or 7 we already answered. So I guess that's good. It means we hit on the right content. I'm going to try and cluster these a little bit. First, let's talk about the fees for the data fees and how that is, how people go about budgeting for the fees. As you had mentioned, that the fees for the data sets would be deleted so you don't have to include the fees to obtain the data sets in the budget. I'm sorry if I wasn't clear about that, but you do need to, if you that there will be fees attached to the to any application to one's data set. If a project is approved, there will be fees attached to that. So that can be estimated in the budget to account for what, depending on whatever linkage you're proposing.
Excuse me, Margaret, if I may, I'm not exactly sure what the intent of the question was, but if
I think
the question is, do they need to include the fees in the budget for pilot grants? The answer is
no, but data only, right?
Just your own expenses. The 40,000 covers the applicant's expenses, and the fees are waived. If you are applying for data, or if you apply for a pilot and don't get, aren't fortunate to be one of the 4 awardees, you're still eligible. But the project's approved. You would be eligible to get the data, but only if you pay the fees. And our staff will produce essentially an invoice of the fees that are applied to your project. So applicants don't need to do anything about estimating fees. We'll do that for you. Just tell us what you want to do, essentially.
And it would be for those who receive pilot funding, we would have a fee structure where it would be a subcontract agreement that we would have in place. So again, that's the administrative component, that if there is the exchange of funding, that we would set that up on the Rutgers end. So thank you for clarifying that, Joel. So there are a couple of questions about data dictionaries and whether or not those types of details will be made available prior to the submission of the letters of intent, and how much information, how much detail can we share prior to the proposal submission process. So Jose, do you want to talk about that? I think we can get the data dictionaries that we have in hand up on the website, but you just want to speak to that for a second, Jose, please?
Sure, just wanted to test my mic first. I was having some issues. Can you hear me?
Yes.
Okay, good. Yes, so we are currently working on that. We're just coming through, there's a lot of fields there. So we're just coming through and making sure that no PHI slips through those fields, obviously. So what we want to put up is sort of everything that will be potentially available in the limited data set. So we're still going through that, but our plan is to sort of post that up soon so that at least you can see sort of a list of fields available. And as I mentioned in the chat, there are some, like, for example, for the hospital discharge data, that's already available through the DOH website. So you can see a lot of the information from there. I think some of the other ones, like the birth and mortality data, are not publicly available, but those are the ones that we're prioritizing to make available for folks.
Okay. So somebody is asking now if we're currently in the process of obtaining data from the Department of Health and our focus is consistent with the aims of the iPHD, are we eligible to apply for the iPHD grant?
So does this would be if they already are getting the data directly from the department?
She said they're currently in the process of obtaining data through the iPHD, through the Department of Health. So Rachel, how would you guide people who may have an application pending through the Department of Health, a request for data? Certainly they can make an application to the iPHD as well. What your preference in terms of how researchers should proceed?
Yeah, my preference would be to utilize the iPHD project. Certainly we don't want to duplicate efforts and be requesting from both places, but I do believe that request could be canceled through the department and then submitted to the iPHD project.
Great, thank you. A question about the opportunity to write the fees into a budget if they're applying for pilot funding. that would be written, could be written into an NIH grant, would be possible to get some summary stats for specific variables for power calculations.
Why don't I try to take
Yeah,
that?
Joel?
Yeah, so we would like to be able to do that. We are just standing up the data sets now. So I'm not sure how much capacity, how quickly we'll have that capacity. Does that make sense, Jose? So my advice would be to ask, and we'll do the best we can. We do, the iPHD policies approved by the board actually anticipate that we would be able to do this without sort of going through extensive data use agreement processes to give simple counts for those, for example, who need to demonstrate to a funder that something they want to do is feasible. So please just ask us, and with some caution, I will say, well, you know, that's a capacity we're going to have to build over time. We're just building the data sets now.
Yeah, I also want to add, depending on the request, so I already have sort of a sense for all fields, a sense of the missingness of certain fields. So if it's something like that, I can sort of, we can turn that around pretty quickly. Some of the other requests, it depends on what it is, but you know, as Joel mentioned, feel free to ask and we'll try our best to answer.
The other thing I would recommend to folks for the data sets that are available, so the department makes a lot of these data available in aggregated form through the NJ SHAD. And that's a good way to sort of get basic counts on variables of interest, or I believe AHRQ has a portal for doing counts from the discharge data. Wouldn't be for the most current year, but probably sufficient for a funder.
Okay. Joel, you want to talk a little bit about if, I think this question for you in terms of if an applicant requests only one data set rather than a linked data set,
Yeah.
is that?
Yeah, that's permissible. You know, and there's, you know, there'll be a certain amount of value added to the data sets. I'm thinking specifically of the UB data, the hospital discharge data. You'll be able to link people over time, which one generally can't in the publicly available data sets. So we recognize that that's value added, and folks may be interested in getting the data with the unique person ID created. So I'd encourage folks to apply even if they want to limit themselves to one data set.
Another question is, obviously we're talking about data-driven studies, quantitative studies. Question about whether or not an applicant can apply the study as a mixed method study, and I think the answer is yes.
The answer
as
is
long
yes.
As long as there's a component that obviously meets the research priorities and is sound science on the data analytics side. This is probably a little bit of a Rachel question as well, and as Jose, talking about any potential interface right now or plans for the NJ HIN. So any collaboration between the iPHD and the HIN, the matching ID, use of the MPI, and where there may be some opportunities to build off of the work of the HIN. So Rachel, do you want to take that first perhaps?
Yeah, absolutely. So we have folks from New Jersey Innovation Institute, which is our partner that supports the New Jersey Health Information Network, the NJHIN. That's a public-private partnership. Folks from NJII who attend the iPHD governing board, we're always thinking about ways to leverage and collaborate. And some of the data sets have a master person index number with them now. Not all of the data sets in iPHD, but there are plans to have that occur. So maybe I'll stop there and not speak for Jose about how that might help make his life easier.
Yes, that would certainly help. As you mentioned, we currently don't have it for everything, but that's something that when it becomes available would gladly want to integrate into our process because it would just make things, it would just harmonize the data sets across, even not only for what we have existing, but what we have planned for the future to come in to the project.
Okay. Can the researcher share the data sets with other investigators, or is the use restricted to particular investigation? I'll let Jose to follow up, and but it's really the execution of the data use agreement that will need to be in place between Rutgers and the researcher who will be accessing the data. So it's not a spin-off from there. There will be guardrails, obviously, for the use of the data that'll be articulated in the data use agreement between Rutgers and the specific applicants who submit the proposal and are approved. Jose, anything else to say?
No, that's it. It'll be governed by the data use. So if those collaborators are part of that, then they're sort of tied to that. But we will not allow sort of just the researcher to sort of share that on their own, and sort of everything has to be approved by the iPHD governing board.
And Jose, as well, that a correlated question is can there only be one investigator or PI, or can there be co-PIs, co-investigators? And there can be.
Yes.
And that, again, that will be, we will have a data use agreement with the institution between Rutgers and the institution that will be receiving the data. So it can be a research team. Here where the data sets already linked, or will the researcher be required to link particular data sets? Jose, do you want to talk a little bit about, I think what is getting at is, is each application going to be a new linkage? Is there going to be sort of standard linkages, recycled linkages, on the shelf linkages, or maybe talk about how each linkage will be undertaken to respond to applications?
Right. So our plan is to sort of do the linkage on a project by project basis. That being said, there will be sort of projects that will utilize similar data sets, or whether it be similar years or similar populations that will be aggregated. So then in those cases, yes, we will sort of build upon what we have established. But one of the things that was early on in this project, that it was not to sort of build this massive sort of data warehouse and have all these keys, and having all this information is sort of, we have to protect it. So the idea is generally project by project, but like I said, there will be instances where there will be a lot of overlap, right? So in that case, then the linkages will apply for more than one project.
And we anticipate that at some point as this grows, that'll happen, more frequently as there are more consistent linkages. One of the last questions, or two remaining questions, I think. So Rachel, going back to, as Joel was saying, that if you're requesting only one particular data set, you're not looking to have it be linked, and that there is value added from receiving the data through the iPHD. But the question is, will this process for data replace the one through the DOH Rowan process, the Rowan IRB for New Jersey hospital discharge data? And a follow-up question about the comparability of any fees and costs.
Yeah, so ultimately it may. What we're very conscious about is not disrupting opportunities for existing or current research projects that are accessing data through the department. Right now, we have a number of good and valuable research projects that have come directly through the department. So I think we'll revisit that at some point in the future, but we have not made a pivot at this time to disallow any researcher to still come to the department for data sets.
And I think that when we were developing the fee schedule, that we feel as if these fees are competitive with other data sources, ResDAC, other if folks are have experience in getting data from other sources, other federal sources. It's not an inexpensive proposition. So and that's frankly what part of the funding that the Department of Health has offered us. We've been really mindful of trying to make this an affordable opportunity for the research community. One last question so far, and we'll keep encourage folks if they have any remaining questions, but the last one that's been up so far is to talk about specific data sets that we have in hand and the insurance status flag in any of the data sets that we have. Do all of the data sets include the insurance status field, such as whether or not they're enrolled in Medicaid?
So I think the only data set that will be available in this first round that has an insurance indicator is the hospital discharge data. And that has fields for expected payer upon admission, which doesn't always map to the ultimate payer at the end of the day after the claims adjudication happens. Researchers commonly use that payer field to classify people by insurance status, and it does include a flag, if it does flag when Medicaid is expected to be the primary payer. The other data sets won't have that field, and no Medicaid in the data in the iPHD quite yet. We hope one day there will be, but that's it for now.
Okay, any other, give colleagues a minute or two to put any last minute questions?
These are great questions. Thanks, everybody. Just one quick clarification. I think we covered this, but maybe I spaced out. So the IRB approval must come from the institution that's hosting the data project. Unlike the current DOH process, which requires folks to go through the Rowan IRB, in this case, only Rowan investigators would need to do that. That's an attempt to streamline this. Obviously, IRB approval is vitally important and essential, but as long as a properly certified IRB signs off, and we have that on record, the project will be approvable.
And from Rutgers' perspective, Rutgers is not engaging in research. You know, that's why the IRB institution is the institution of record for the research institutions.
Well, the center, in this case, for the iPHDs, this is not research, it's a research repository, it's a data repository for those who are into the fine print on IRB. So we do have IRB approval to handle the data, but every separate project will need its own IRB approval.
Last call for any. Okay, two more questions. So Jeanette Valentine asks if she says the birth certificate data does have payer in the confidential portion. Does the VIP data set include that confidential portion, which would therefore then include info on the mother?
I stand corrected. Jose, do you know the answer to that?
Yeah, well, I do see, I was looking that up earlier, a field on it. I don't think it's populated very well. And obviously I would defer to our colleagues at DOH and the data stewards who are more intimate with these specific data sets themselves. So I am seeing a field that does contain, is the mother Medicaid participant, although I'm just seeing it's not very well populated in terms, there's a lot of missing information on there. So at least for the current year that I'm looking at.
So I just noticed Abate put a note in the chat. He's a man who would know, having been formerly at DOH. He says it's there. So we'll double check.
Once a DOH, always a DOH. Right. Got it.
Thanks,
Abate. Follow up on that, keeping on that theme, do the data sets address the changes in data structure over time? Jeanette is pointing out the VIP changed over in 2016, or does the investigator have to bring those questions to the, make those issues known, potential changes? Jose?
Yeah, so one of our goals with the project is to eventually harmonize that to whatever extent possible. But we understand the challenges with that and how that may not always work for, the certain researcher at the time or particular research question. So, I was advised by the data stewards on how the process happens and the changes that make sense, and they can't always be harmonized, but there could potentially be some fields, just thinking off the top of my head, for example, certain race categories or something like that, that sort of you want the same value, or roughly the same value over time, instead of looking at multiple fields or different field names to put that together. So it's currently not set up that way just because we want to be cautious and sensitive to that. But eventually that is something that we would like to work on and sort of standardize and harmonize over time.
I'll just add to that sort of our philosophy on this is not to make analytic decisions for the researchers and leave that to them, but just to do the best job we can to make the data and the documentation transparent. So if there's changes in definitions, we will do our best to document that. And then in terms of mapping one category to another over time, that's an analytic decision. So we'd leave that to the investigators.
It looks like we have one more question going back to the IRB question. Can we say more about why it's important that the IRB be based in the institution, the organization receiving the data? And I'm not sure. And then it said any, the second sentence is not a collaborator overseeing the data receiving the institution. So can you maybe just a little bit
so
more?
let me give it a shot. And I don't know if Rachel, if you want to chime in as well. So the goal here is that a duly authorized IRB with a federal-wide assurance number that applies to the applicant has approved it. We know that sometimes, isn't necessarily their own university IRB. They may use, say, the Western IRB or something like that. It has to be the practice of the institution applying for the data to get an IRB approval from an IRB they approve of and that they have an agreement with. So I hope that clarifies. That we're not being rigid here about which IRB it needs to be, but it needs to be a duly authorized IRB with responsibility for oversight of the project at the given institution.
And we just got it, thank you on that one. So
oh, good.
I think that's well said. And Maria Barron, our colleague from the Center for Health Statistics at DOH, is commenting that while she's not specifically involved in the iPHD, but certainly on the DOH end, and there is an extensive project going on to map the VIP platform to VERI. So understanding all of the work that has been done heretofore through the department, and acknowledging the work of our colleagues who Jose has been working with over the last couple of years, the data stewards, to conceptualize and think about the transfer of these data sets over to the center has not been insignificant. So acknowledging the work of our DOH colleagues within the Center for Health Statistics and then the stewards over the specific data sets. There's a lot of work that's already have been done at the department that should be recognized.
Absolutely. And I think we recognize that work with administrative data that were not created for the purposes of research raises lots of analysis challenges, and part of the iPHD law is to promote the use of these data for the greater good in New Jersey, and the law anticipates that we need to have lots of discussions about data quality and what's possible. And we intend to use the research consortium process to bring folks together, to share, to learn as a New Jersey-wide community. So all these great questions are things that we're going to be talking about over time. You know, hopefully in the near future, we'll have a bunch of projects using, looking at insurance questions in the birth and other data, and we'll have that conversation. So thanks for raising these questions, and it's definitely on our agenda to facilitate these kinds of communications.
Okay, I think just offer last call on the questions. I think we've gotten through most of them, either specifically in asking them, or they had been answered through the panelists' comments and the slides. So clarification on how funds can be used for personnel costs. So I think you'll see in the budget sheet that's on the template on the website to be able to calculate what your all of your costs are. So looking at providing the fringe, the personnel fringe benefit costs and its caps. So there's a formula in the spreadsheet. So the request cannot exceed $40,000. So again, I think that we encourage investigators to budget the time that they think they need to do the work. We will rely on you to have that expertise to know what it's going to take. Whether you have multiple people at $40,000, obviously is not a huge amount of funding, but hopefully it will cover some time for one or two faculty staff to be able to lift the project up and to support personnel time. No, not a cap per person.
No, there's no salary cap as there is in the NIH guidance, but if you're budgeting a large amount of time of very expensive people, 40,000 won't go very far. So there is an effective cap there.
And if you're at Rutgers and put the fringe rate in, then, you know.
Or any state institution.
Any state
right?
institution.
Yeah, that's another story.
But I do think, you know, again, we're going to do our best and we're looking at 4 pilots this time. We've already queued up a minimum of 2 or 3 in the next round as well for the January cycle. So when you combine the pilot with having your fees waived, it's a nice support for a small project. So we hope you feel the same way.
And we'd really encourage folks to think about, you know, doing a modest project for the 40,000 to build toward getting additional funding from sources that give bigger grants. And that's really part of the intent of the iPHD, is to help build that capacity in New Jersey. So we hope the pilots go to that purpose.
Okay, I think we've covered them all. And again, terrific questions. We're going to roll some of these up and then add them to our FAQs on the website. We're also going to be getting more detailed information about the data dictionaries on the website and be able to share that, understanding the value there and conceptualizing, putting together even the letter of intent, right? The clock is ticking both on the LOI and in the full proposal July 15th. So I think that's it on the Q&A. We will circulate both the presentation and the recording of this webinar.
And please do complete the post-webinar survey.
Rachel, any final thoughts?
I'm so excited, and thank you so much, everyone, for participating today. And thank you in advance for submitting applications to use the data in the iPHD project for research projects. Thank you.
All right. I think with that, we can we can close and thank everybody for their time. Thank you, everybody.
Thank you.
Thanks.